do something like this.
Okay.
So in your opinion, what is the file that should top the agenda of the health ministry in the coming period?
Satisfying the internal customers and the external customers, i.e. the doctors and the patients. Immediately we have to gush a lot of money in trying to sort out the basic problems that Egypt is suffering from over the last 30 years, I would say. Meanwhile, try to pay the doctor a bit more than what is happening at the moment, or making the working condition a better. So those are the two things, satisfying the customers that are looking after the health sector.
But still we have shortage of hospitals. We have to build more hospitals.
We have to build more
first.
hospitals, but we cannot do this tomorrow.
Yeah.
So till we do it tomorrow, we have to satisfy the doctors who are serving the people and open venues for the poor people to be looked at immediately.
Don't you expect the healthcare insurance to include many citizens in the country?
They have to. They have to. This is a fact that's happening everywhere. In countries like India, where people are passing the 1 billion people, they are now doing most of the things through the insurance, through the cooperation between the government and the private sector and the institutional groups. We have to move towards something that is a compromise between totally free health service and very expensive one.
Mm-hmm. But sir, there are some diseases that seem to be spreading here in Egypt, and the government efforts have failed in this regard, such as hepatitis C, for example, and kidney issues. These diseases, especially the hepatitis C, is spreading. We have a growing number of patients every year, and it seems that the problem has not been solved. In your opinion, how can this be part of the whole system of improving the health sector here in Egypt?
Yes, okay. Let us take the hepatitis C issue as a benchmark and take it from there. The problem with the hepatitis C treatment was the very expensive medication that is used in treating it, and the very long course and the very bad side effects. Now the government made this kind of communication with the authorities in USA that is capable of producing this new medication. The medication that came to Egypt very lately, we have a backlog of patients that are suffering for ages now from hepatitis C. So that we are certifying patients now to give them the proper medication. This medication, although it has been supported by the government, and it is far cheaper than the previous one, yet it's still very expensive. I mean, the patients cannot go to a pharmacy and buy it. He still has to get it through the government. So the backlog of the patients who were queuing to get this medication, and the new patients every day, we are discovering them as hepatitis B patients, without taking into consideration that we are seeing in hepatitis C the tip of the iceberg. This is that regardless the numbers that are said about the problem is far bigger than this. So what should we do now? Get rid of as much as waiting patients in the queue by giving them medication as soon as we can, without a lot of formalities. We need a registers that can be referred to, a registry, a national registry, where we say this patient had received this number of tablets, he will not receive anymore, and wait for the outcome, so that no patient takes what he doesn't deserve, because this is going to be on expense of another patient.
Yes.
And keep the good work going, because this is an achievement. This is an achievement for the government. So let us work on it to continue. But there is no magic in healthcare. We have to start today and get the fruits in 10 to 15 years ahead.
Okay, when people are treated with this new medication, they are not going to infect others after that? Because the problem here in Egypt is infection. People are infecting each other quickly with this virus.
Studies that has been done in the late 70s, mid 80s, trying to know how Egyptian people and the whole world people getting hepatitis C were suggesting that it is mainly transmitted through the blood products. And in Egypt, using the common things together, like shaving in a common barber places, were a main issue. Now we are trying to prevent this from happening. Yet as the expertise of the hepatitis C / hepatitis B / hepatitis E and all of the hepatitis disease that we are knowing at the moment are saying, although let us say 90% of the cases are transmitted through blood products, so don't do this and don't do this and don't do this, yet there are index cases that has nothing to do with blood. So we have to be very careful. We have to be very careful. And this is through a lot of media work, for example, how to prevent infecting yourself and your wife especially, and your children, because if your wife infected with hepatitis C, she will vertically infect her children and so on and so forth. So it's media work, governmental work, and also the people work. But it will take ages. What I'm trying to say is we have to have a starting point. But gathering the fruits will take some time.
What about the government's precautionary measures to prevent Ebola virus to Egypt? You think it's enough?
Like what happened with coronavirus. Number one, we have to be able to diagnose the cases. Ebola is a horrible disease. And if we are having an index case, it should be isolated properly. And in dealing with it, we should be very careful. Ebola did not arrive to Egypt yet. But yesterday, as we heard, in Jeddah International Airport, Nigerian patients fell dead, and it might be a case of Ebola. This is a scenario that we might be facing in Egypt. A patient come on his feet, but in the airport, he will fall down. And then the rashes that he's having, because Ebola is associated sometimes with some rashes, might be. So in this very moment, people should not run to help and touch and deal with, because they will be infected and infect again.
Okay. Well, unfortunately, our time is up, but for the time being, Dr. Hisham Omar, pediatric consultant, thank you very much for coming and highlighting the major difficulties and challenges facing the health sector here in Egypt. Thank you very much.
Accept me today. Thank you.
Thank you, Dr. Hisham. And this brings us to the end of today's edition of the Breakfast Show. Okay. See you tomorrow in a new edition. Bye.